Hi everyone, I'm going to be talking about my capstone experience of when I took care of a patient on the labor and delivery unit. So a little bit of my patient's background was that she presented to the ER with a decreased level of consciousness along with very visible ascites and vaginal bleeding. Because of the amount of fluid in her abdomen, they performed a paracentesis, which was guided by an ultrasound that also confirmed that she was pregnant. The patient stated she did not know she was pregnant and that she also did not have any prenatal care. It was later determined that she was at 26 weeks gestation. Along with no prenatal care, she tested positive for alcohol, marijuana, and methamphetamine in her system. Another ultrasound was ordered, which showed a complete placenta previa, which would explain the bleeding, and that also would require a C-section. Also, the fetus showed signs of fetal alcohol syndrome. She was then admitted to the ICU because of her level of consciousness. Along with her ascites, she had a history of cirrhosis, that is known as a chronic liver damage from a variety of things that leads the liver to scar and end up in liver failure. Some causes of liver failure include excessive alcohol consumption, obesity, or long-term hepatitis B or C infections. Her other history also includes GI bleed, hypokalemia, hepatitis with ascites, MRSA, alcohol withdrawal, depression, anxiety, preeclampsia, endometriosis, drug and alcohol abuse, thrombocytopenia, and sexual violence. So it's a very extensive list. Next, I'm going to talk about her assessment when she got onto the labor and delivery unit from the ICU. So for the most part, her vital signs were within normal limits. Her heart rate was between 70s to 100s. Her blood pressure was 115, 130 over 80s. Respirations were always between 12 to 14. Temperature, she was always afebrile, and her SpO2 was always 96 to 100% on room air. However, she complained of constant pain without being able to pinpoint where it was at. Therefore, she was on a lidocaine patch and Subutex for pain. Her other medications included lactulose for her liver, Lasix, and Visceral to help her sleep. Her lab values were a little off, with her platelets being 77, which is low. However, she had an episode where they were at 28 when she was first admitted, which is extremely low. Her ammonia was at 72.2, which is elevated, with normal being 16 to 53. She also had an episode where she was at 148, which led to her unconsciousness, and which is why she was admitted to the ICU. The other labs that were taken were her AST and her ALT. Her AST labs were 40, which is on the higher side of normal, and her ALT was 22, which is within the normal limits. Moving on to her physical assessment findings, the patient had an increase in abdominal girth and weight, many bruises on her arms and legs and abdomen, needle pokes in her antecubital spaces on her arms, and she also looked dirty, like she had not showered for a few days, and her scent was just a very strong odor. I briefly touched on the diagnostic tests up in her background. So now I'm going to move on with her nursing diagnoses. The first one was alteration in comfort related to cirrhosis, as evidenced by patient stating pain, a 7 using the 0 to 10 scale, and patient was visibly in pain. The second was potential for fetal compromise related to drug and alcohol use, as evidenced by category 1 fetal heart tones. And the third nursing diagnosis was risk for impaired parenting related to lack of knowledge about parenting skills. Moving on to her planning, finding her rehab to help wean her off of the drugs and alcohol, encouraging a low sodium and low fluid diet, decreasing her pain severity by reaching a tolerable pain level for her, and also helping to provide support and resources for the patient in regards to treatment of child services. I put this one on because the state was actually not going to allow her to keep this child. She also had other children that she did not have custody of, and so she was also not going to be able to have custody of this one as well. So for implementation and interventions for alteration and comfort, continuous pain monitoring and administering the medications, as well as using alternative therapies for pain such as guided imagery, massage, or aromatherapy. For psychosocial diagnosis, to contact child services to help support the patient with the state's decision, And for her ascites, providing foods that are low for the body's nutritional requirements, lowering her fluid intake, limiting her sodium intake, avoiding alcohol and drugs, and reducing factors leading to temptation of drug ingestion by not allowing her significant other to visit because he would actually bring drugs onto the unit and she would take them. For evaluation, the full evaluation was not able to be performed on this patient because of shift change, but when the interventions were complete, the following would be evaluated: to measure the effectiveness, to continually monitor her ALT and AST levels, continuously monitor the baby in utero and the baby afterwards for adjustment to no drugs or alcohol being ingested, and the last one, provide opportunities for the parents to express concerns or ask any questions. So that is what I have. Thank you for listening.